Osteoporosis, or bone loss, is a condition that normally affects the whole body due to age. However, transient osteoporosis of the hip is quite different from advanced age bone loss. As the name suggests, it's mostly a fully reversible regional condition. It doesn't affect the whole body but only occurs in the hip. Although its occurrence in men is slightly more common, in women, it generally develops towards the end of pregnancy. Even though it usually heals without much intervention, as the name suggests, it doesn't always have a happy ending. Sometimes, it can cause fractures in the hip and occasionally lead to avascular necrosis of the hip. When diagnosed, you might be confused and unsure about what to do next. You may be anxious about what kind of process awaits you and what the outcome will be. You'll find the details in this video. Transient osteoporosis of the hip is generally a benign condition that self-resolves, and its cause is unknown. It's also referred to as bone marrow edema syndrome or bone marrow edema of the femoral head. It mainly occurs in middle-aged men. However, cases have been reported as early as 20 or as late as the 80s. In women, it usually develops in the last 3 months of pregnancy. Pain in the hip and groin area during the last pregnancy trimester is typical for this disease. The upper part of the femur bone in the hip weakens due to bone loss. In this area, there can be an undisplaced fracture known as a hairline fracture. Some cases might be triggered by trauma, surgical procedures, certain medications, or neurological diseases, but most have no identifiable initiating factor. Regardless of an initial cause, the process functions the same for both. Patients can present to the doctor with vague hip pain, ranging from mild discomfort to severe pain that prevents weight bearing. This pain is located in the groin area at the front of the hip. It can also radiate to the thigh and knee's front inner part. Sometimes, this knee pain is more pronounced, and we might even struggle to explain to the patient that the problem is not in the knee but in the hip. Although the likelihood of it being bilateral is rare, such cases exist in the literature. It should be suspected in middle-aged men and women in the last 3 months of pregnancy who present with sudden hip pain. While X-rays might show reduced bone density in the head and neck of the femur, the diagnosis is typically made with an MRI. Blood tests do not reveal any abnormal findings. There's no need for bone densitometry due to the term bone loss. If bone density measurements are taken from other areas, they are expected to be normal. The early stages of avascular necrosis of the hip can be very similar radiologically to transient osteoporosis of the hip. Even an experienced radiologist or orthopedist sometimes needs help to differentiate the two. If it's transient osteoporosis, there's no concern. After all, we know that the disease will heal on its own if we prevent the patient from bearing weight on that leg for a while. The crucial thing is to distinguish it from avascular necrosis. Because a simple procedure on the femoral head in the early stages of this disease could save the patient from subsequent hip osteoarthritis and a hip replacement. I'm placing the link to the first video of a detailed 3-part series I shot on this topic here. If you're interested, you can access it from here. If we have difficulty differentiating between the two, we might recall the patient for a follow-up and order a new MRI. In avascular necrosis, the necrotic area becomes more evident, whereas improvement is observed in transient osteoporosis. The most significant challenge in the diagnostic phase, especially during pregnancy, is the reluctance to use radiation due to concerns of harming the fetus. Although MRI is considered safe except for the first 3 months of pregnancy, patients and doctors might still have reservations about undergoing this scan. In pregnancy, since the diagnosis is usually made in the last trimester, which is a relatively safe period for MRI, the diagnosis can be confirmed with an MRI. Transient osteoporosis of the hip clinically has 3 stages. In the first stage, the patient's hip and groin pain starts suddenly, radiating to the knee, making the patient feel like there's a knee problem. The patient's history might include a vague trauma. In the second phase, osteoporosis develops. The third and final stage is the clinical and radiological recovery period. In this phase, the patient's complaints decrease, and improvements are seen in radiological findings. Even though we don't know precisely why the disorder starts, the problem causing the pain is the increased pressure within the bone. I think you'll better understand the situation this way. If you hit a part of your body, the body's healing process starts due to the impact of the trauma. The vascular permeability in this resting tissue increases, allowing the body's repair cells to migrate toward the area. With increased blood supply, the area swells, and edema forms. Once the healing process is complete, it reverts, and the tissue returns to its normal resting state. We call this process inflammation. The healing process works the same way for all tissues in the body. Bone is a closed tissue with no possibility of expansion and is very well vascularized. When the same healing process occurs here, cells exiting the vessels and increased blood flow raise the pressure inside the bone. This increased pressure affects bone oxygenation and metabolism. In later stages, if no rest is taken, the increased osteoporosis can cause tiny cracks in the bone. During this process, the increased pressure can, although rarely, affect the blood vessels supplying this area within the femoral head, potentially leading to a condition known as avascular necrosis or osteonecrosis of the femoral head. If such a situation arises, I recommend watching the 3-part video series I made on this topic. Although the disease usually heals within an average of 6 months, this period varies from person to person. It can sometimes be 2 months or even up to 12 months. Typically, no complex treatments are applied. The patient can walk with crutches if it's only on one side. If it's on both sides, the patient is advised to use a wheelchair. Certain painkillers and anti-inflammatory drugs also help accelerate the recovery process. If it occurs during pregnancy, it usually resolves on its own within a few months after childbirth. I'd like to proceed with the video after making a reminder. Doctors, with their extended training and years of experience and knowledge, examine you and review your tests before diagnosing. These videos contain information that can serve as a reference for those diagnosed by a doctor and wish to learn more about the condition. Patients should not use them for self-diagnosis. Taking such a path is very risky. To avoid mistakenly overlooking a severe health issue and potentially entering an irreversible process, always confirm your health concerns through a doctor's examination at a hospital. Specifically, regarding this condition, trying to diagnose yourself and confusing the osteonecrosis of the hip or stress fractures with this more benign disease can lead you into a much more complicated and challenging to reverse situation. Please be cautious. Although studies suggest that bisphosphonates, calcitonin, and teriparatide shorten the process, these studies are based on limited patient numbers, and there needs to be more data to generalize. The core decompression method, which involves drilling a hole in the femoral head during the painful phase, may reduce pain and shorten the process. However, it is said to have no superiority over drug treatments. In conclusion, if you find yourself in such a situation, it is often advisable to reduce weight bearing with crutches or a wheelchair, use painkillers, apply heat, and use therapeutic ultrasound while waiting for the process to complete. This will typically lead to recovery. The treatment plan changes entirely if there is a fracture or the presence of osteonecrosis, but the likelihood of these happening is very rare. If you've watched the video up to this point, you might suspect you have this condition. If you do have transient osteoporosis of the hip, it would be helpful to others if you could write a few sentences in the comments about how old you are, how the process started, and how long it lasted. May you always have days filled with smiles, be free from health problems, and remain active.